Chair, sit, and reach test. Older individuals have difficulty performing sit and reach tests because of limitations. Low back pain and poor range of motion prevent them from getting down to and up the floor. The chair, sit, and reach test was designed for this older population to test only one leg. The purpose is to assess lower body flexibility, specifically the hamstring. This test can be applied to activities of daily life such as getting in and out of the bed. You will have the participant warm up prior to all the assessments. The equipment you need will be a folding chair that has a seat height of 17 inches and will not tip forward, as well as an 18-inch ruler. You will place the folding chair against the wall for stability. The client will then sit in front edge of the seat and extend one of their legs in front of the hip with the heel on the floor and the ankle dorsiflexed 90 degrees. The opposite leg will be flexed so the sole of the foot is flat on the floor about 6 to 12 inches close to the body's midline. The client will place their hands on top of each other, palms down. The client will slowly bend forward at the hip joint, keeping the spine as straight as possible and the head in normal alignment. The client will reach down the extended leg, trying to reach their toes and hold the position for 2 seconds. You will place the ruler parallel to your client's lower legs and record the measurement. There will be 2 test trials. Scoring consists of the middle of the big toe at the end of the shoe represents a score of 0. Reaches short of the toes are minus scores. Reaches beyond the toes are recorded as plus scores. Record the best score to the nearest inch. The Canadian Trunk Forward Flexion Test. The participant should remove their shoes and perform a warm-up of moderate aerobic activity and flexibility exercises. The client sits with the back on the wall and without shoes, the soles of the feet against the sit and reach box called the flexometer at the 26 centimeter mark. This will be the only equipment needed. Inner edge of the soles are placed within 2 centimeters of the measuring scale. The participant will slowly reach forward with both hands on top of each other as far as possible. They will hold the stretch for 2 seconds. Be sure that the participant keeps the hands parallel and does not lead with one hand. Fingertips can be overlapped and should be in contact with the measuring portion of the sit and reach box. The score is the most distant point reached with fingertips. The best 2 trials are recorded. To assist with the best attempt, the client should exhale and drop head between the arms when reaching. Testers should ensure that the client's knees stay extended throughout the test. If you are using a box that is set at 23 centimeters, subtract 3 centimeters from each value. Depending on your results, compare it to your age group, and this will give you an idea of what category your client falls under. YMCA Sit and Reach Test. Before testing, the participant should remove his or her shoes and perform a short warm-up of moderate aerobic activity and flexibility exercise. A yardstick is placed on the floor and tape is placed across it at a right angle to the 15-inch mark. The participant will sit with the yardstick between their legs, with the legs extended at right angles to the tape line on the floor. The heels of the feet should touch the edge of the tape line and be about 10 to 12 inches apart. The knees should stay flat throughout the exercise. The participant will slowly reach forward with both hands on top of each other as far as possible. They will hold the stretch for 2 seconds. Be sure that the participant keeps the hands parallel and does not lead with one hand. Fingertips can be overlapped and should be in contact with the measuring portion of the yardstick. The score is the most distant point reached with fingertips. The best 2 trials are recorded. To assist with the best attempt, the client should exhale and drop head between the arms when reaching. Depending on your results, compare it to your age group, and this will give you an idea where your client falls under. Thomas test. This test assesses the flexibility of hip flexors. The hip flexors tilt the pelvis anteriorly. An imbalance between these muscle and the hip extensors could negatively affect the functioning of the lower back. You will have the participant lie supine, meaning on their back. The client will bring one of their legs, the contralateral leg or the leg that is not being tested, in the direction of the chest, just to the point where the lumbar spine is snug to the floor. If the tested leg remains in contact with the floor during this maneuver, the hip flexors of that leg are adequately flexible. If the tested leg rises, its hip flexors are likely to be inflexible Record whether the hip flexors in the right and left legs are flexible or inflexible. Straight leg raise test. This test assesses the flexibility of the hip extensors. The importance of the hip extensors is that these muscles tilt the pelvis posteriorly. An imbalance between these muscles and the hip flexors can negatively affect the functioning of the lower back. The patient will lie supine, meaning on their back. The equipment you will need for this test is a goniometer. You must make sure that the patient's low back is snug against the floor. The tester raises one of the participant's legs while ensuring that the other leg remains extended and flat on the floor. You will measure the angle of flexion, range of motion with the goniometer. A minimum angle of 80 degrees is acceptable for this passive straight leg raise. However, an angle of 90 degrees is desirable. You will record the angle and report whether the range of motion is acceptable or unacceptable.